Well, let's talk about using technology for writing clinical notes in the easiest way possible that gives us great information and insight. So, to speak about this, I'm really glad to have with us Dr. Robert Budman, and he is with Nuance. And you're probably familiar with Nuance with their dictation technology. Doing audio transcription for clinical notes. And Nuance has expanded in a really cool way with their ambient clinical intelligence technology. So I'm really excited to speak to you about this, Dr. Budman.
Great.
Yeah. And so thank you for your time.
Happy to be here.
So at the Telehealth Certification Institute, we try to let people know about the really cool, innovative technology that's coming out and that exists for healthcare to make our job easier and better, improve clinical results. So I'm really excited about this technology. So if you can just maybe give us a background, like what is ambient? What is the ambient clinical intelligence technology? How does it work? What does it do?
So I'll tell you about ambient clinical technology or ambient clinical intelligence kind of in a nutshell, and then I'll give you a very brief history of where it came from.
Great.
So ambient clinical intelligence in a nutshell, like I mentioned, is the ability to simply listen to a provider-patient interaction without touching a keyboard. So I always say, think of Star Trek. The computer's listening. It can tell the difference between the voices, and it automatically records it and creates a note. It uses artificial intelligence and a lot of other tools and things behind the scenes to make that note relevant and look like the notes that we currently write. That's really it in a nutshell. So if I could spend, and the value statement there very quickly is, if I could spend all the time with the patients and not tapping on the computer or after the visit trying to remember everything, I've got a complete, valid, true narrative of what happened in the exam room or wherever, the therapy room in this case, perhaps, to make the note. And it's very accurate, and it's the real story of what's happening with the patient. And then you can make inferences off of that, of course. Let's look quickly at the roadmap. Maybe 20, 30 years ago, programs came onto the market in technology that would listen to your voice, and instead of typing in the computer, the words would appear on the screen. That is, voice to text or speech to text, speech recognition, voice recognition, various terminologies that are out there. Our product at Nuance is called Dragon, and it's been around in the commercial and the medical space for decades, and we're constantly improving it. We've got an international group of developers and engineers that write code, and now it's in the cloud. It's even faster and more accurate. Well, with Dragon, what we did at Nuance is started developing biometric technologies. That means the ability to use voice biometrics, where I hear my voice, I hear your voice, like a fingerprint. It's virtually uncopyable, and I can use it to authenticate who you are. Why is that important? Well, we know for banking, a lot of the banks now, you call in and they immediately say, oh, hi, Robert, we verified that you're the real person. It's not a recording. It's not someone who's very good at impersonating your voice. It's really you, because it's that unique, that voice fingerprint. But then we started applying it in the healthcare realm. So very quickly to say, if there's a nurse in the room, a doctor in the room, a patient, a child, a caretaker, an elderly parent, you can tell every voice, record those, and properly put those into the note and ascribe them to the person who gave you the details. And here we are today now with DAX, utilizing that technology of voice biometrics and speech recognition with the AI to automatically create the entire note. Because remember, parts of the note go in the history of present illness, the past medical history, maybe even the physical exam if the physician articulates it or verbalizes it as they're doing it. Your arm is not moving, in a full 90-degree motion. And taking what the physician says in terms of well, I've spoken to you and you have XYZ diagnoses. Here's the plan, and I can explain it to you fully. Think about that in terms of how would I create a complete note like that, remembering every single detail and writing it into the note, or as we joke about in medicine, in legacy medicine, primary care, well, I just use a copy paste, or I use a template, and that's very impersonal and misses a lot of details. So that's kind of the whole, in a real quick summarization, where ACI is now with what we call DAX, or Dragon Ambient Experience. That's the name of our ambient clinical intelligence, is DAX.
Right. Okay. Yeah. I remember I used Dragon a long time ago and I loved it. It worked awesome because I hate typing notes. So Dragon years ago worked really well.
Yeah.
So yeah, I'm sure it's way better. And then I remember about 10 years ago working in hospitals where they started bringing in a whole bunch of scribes with the physicians.
Yeah.
So you have the physician, then you have the physician scribe, and they're the ones doing all the note taking, submitting
Right.
things, putting everything into the EHR. And I always thought to myself, wow, like what kind of training is required here? Like, how do they know what to put in? And the doctor's telling them kind of what to put in, but
Right.
then you still have to use a lot of judgment. And then I also know clinicians hate doing notes. You have the clinical session. And when I look at my own medical record and I look at the session notes, the visit notes of the physicians I've seen, it's like one sentence. Like, they don't, nobody wants to put in notes. And in the behavioral health world, most, like a lot of clinicians, probably most, don't even write notes because they can't stand doing it. And then, it's so subjective. Everyone's confused in terms of what to put in there.
Yeah.
It's so laborsome. And like you said, the whole copy and paste, I've known so many people that have done that, which is really prone to error and doesn't create very good notes for clinical use. So this is, and then the verification of identity that you're talking about using the biometrics. Yeah, I love it. I mean, and for it to be ambient, I like the word ambient because you don't even have to worry about it. You don't have to click a button. It's just going to do it for you. Yeah, I absolutely love that. So I see the need, and, and then we're all about open notes, right? Providing patients, clients, the notes. And if the notes don't have very much information in there because they're laborsome and whatever, having an intelligent system, AI, developing notes that is useful for everybody, useful for the clinical team, useful for the patient, useful for billing purposes. Really takes a lot of guessing out of the game there. So I love it. And so the use cases, can you maybe just mention some of the use cases? So it'd be you're having a clinical visit, clinical session. It's just going to listen in, right? Create the note of the visit. Are there other use cases? What about using it for telehealth? And if you are using it for telehealth, is there any additional privacy, security, measures that we ought to be considering with that?
So we started years ago with orthopedics, and the reasoning there was we knew pretty much what the templates were. We knew a handful of diagnostic categories: arthritis, shoulder problems, knee problems, ankle, hip. And the case models were a little easier. So we started there and cut our teeth. And what happened is we started developing literally millions and millions of notes and case models that we could use the neural network on. That's the artificial intelligence brain, to continue to develop it. There's millions of lines of code written into these programs. It's not like a few people in the back room, let's write some artificial intelligence algorithms. No, these are gigantic neural networks. And that's where the accuracy comes in. Did he really say that, he had trouble sleeping, or I ruled out trouble sleeping? So it gets very smart. And as it got more and more accurate, we developed a roadmap to go to more and more specialties. dermatology, ophthalmology. And the roadmap spans over a couple of years so that eventually we'll be able to do virtually every outpatient specialty. And what we'll start doing then is branching into other areas of medicine, whether it's inpatient, emergency, the surgery suite, and things like that. The recording, to your point, is ambient. I could simply say, you know, Dragon, start recording my examination or my interview. But there's also an app on the phone. I don't know if you can see it in the Zoom, but you just tap a button and it starts recording. Generally speaking, you can ask the patient, I'd like to record this. This will automatically generate our notes so I can spend more time with you. We have a very high agreement rate, probably way over 90%. Most people think it's great and they love being face-to-face with their physician again. Not, or as my 90-year-old mother says, I went to see my PCP, but he just looks at the computer the whole visit. But to your point, yes, we can create those recordings across telehealth too. Our conversation could have been fully recorded with ambient and create a transcript for you. So you can use it within Teams. You can use it. It's really agnostic to almost every telehealth vendor. It goes through a secure VPN, of course, HIPAA secure, SOC 2 security, all those terminologies that we're familiar with, de-identified in the back, stored for 3 years in case it needs to be brought up for anything else. But that recording is what the AI uses in that neural network I mentioned to diarize with the voice biometrics exactly what was said. And it knows to take out the jokes or, the other day I went to the beach and I tripped on a seashell and I got a seagull up my nose.
Yeah.
It knows to remove that stuff and it just focuses on the clinical things. If the physician wants to make a particular notation of something like, oh, you have a dog named Snowball, make sure that's in the record. And it hears the physician's voice and does that. So that's really great because, sometimes we go back, we want to be personal with our patients.
Oh, yeah, definitely.
When you have hundreds of patients, you can't remember all their dogs' names or their kid is on deployment with the military. Those are important follow-up questions.
Yep.
But to your point, it's very secure. And we cordon that off, like I said, for 3 years. And then we use those for quality improvement processes, and then they're deleted.
Yeah. So you started with oncology, you said, right? No, not oncology, orthopedic, right? Yeah. Orthopedics. Yeah.
You had the O.
Yeah. And then you need enough data, clinical visits. I assume that it's learning from the recording. And then you have clinicians like teaching the AI, reviewing the transcripts and so forth. Like how does that work? How does the learning happen?
The team is very extensive and it goes across many different personas within the IT environment. Yes, we have physicians, we've got PhDs in neuroscience, we've got coders. And by coders, I mean, we've got computer programming as well as medical coders involved, clinical documentation improvement people. It literally is a village of people across multiple countries working on this night and day to continue to improve it. And one other important thing that we've done in the beginning of each specialty, and as we create these notes, is what we call a QDS, or a quality documentation specialist. Not unlike a scribe, but someone who's looking through the notes, for example, with traditional transcription. Did we miss a word? Let's go back and look at the recording. Or did did the AI capture that quite right? Can it be edited? And that also helps in the beginning stages to make sure that the note is more accurate. Plus, we can work with individual physicians to develop sort of their documentation style, believe it or not. And then once all that work is done, 60, 90 days, looking at hundreds and hundreds of notes, and then getting to a fully automated note where I would literally be talking to you. And at the end of this telehealth interview that we're having, we would have a fully completed note. We wouldn't have to edit it very much at all. But yes, we do ask physicians, just like in the days of transcription or dictation, look at your note before you sign it. Do you want to make any edits? But let me tell you, that is much faster than writing the entire note. You made that allusion and reference to the burden of the EHR and the challenges of EHR documentation, whether you're using templates or typing or automatic text. It's very challenging. We've literally transformed medicine because we're supplying something that the EHR can't do. We're going to, instead of hacking away at that computer keyboard or trying to learn all the ways to make a note in whatever EHR you happen to be in, I'm just going to let you punch a button on your phone and I'm going to automatically pull a note in for you.
Yeah.
That's the big win.
Yeah. Yeah. So Nuance has years of building the technology, for dictation using Dragon, and Microsoft, has all of their technology. So in partnering with Microsoft, what did Nuance bring to the table? What did Microsoft bring to the table?
So Microsoft, obviously a gigantic company. We were also, a multi-billion-dollar company, but obviously in terms of scale, they're 20 times bigger or some big number like that. So we had more than 10,000 accounts or something like that in healthcare. Where are you going to get something like that? You can't build it from scratch. It would take decades, literally, sales teams, technology and all that. And on the Microsoft side, they had a healthcare division, and, Google, Amazon, everybody's kind of tried to figure out that equation, and they've tried it in various ways with limited success. I think Microsoft saw that, Nuance has great AI, has this already speech capability. And, we were coming out on the market with DAX years ago. They saw that. They had something called Microsoft Empower MD, which has now been absorbed into DAX. And now our mutual engineering teams are together because Microsoft acquired us in total. So Nuance is really just a company within Microsoft now. So we are a Microsoft company.
Yeah.
And now you've got this synergy of bringing the different tools together, the engineering teams, the talent of coding, IT, computer programming, to just really supercharge this and build it even bigger. And it's echoing across the industry. I just came from Idaho, a chief medical officer meeting in Idaho, and many of them were saying, what's this DAX technology I keep hearing about? And there were 4 or 5 people in the audience that, oh, we're already doing this. Our doctors love it. And there are numerous testimonials. You could easily go to YouTube and just type DAX and listen to some of the testimonials they're publicly facing. And just the great things that you're hearing from patients and providers as well.
Yeah, it's super important to hear from end users how it's going before using a technology. I mean, that's how you're going to really find out whether or not it's going to work well.
The references are very powerful.
So there's other companies out there with similar technology, like Google. Google, you can give it information and it will create an article for you from what you provide it.
Right.
And it has the natural language processing, and you have all these virtual automatic, what do they call them? Automated virtual assistants. You got Siri and
virtual
Hey Google
assistants.
So are you able to kind of speak to this technology compared to, say, what Google has available, and what the difference is between the different types of technology when it comes to voice, using voice automation, natural language processing, et cetera? Can you help us understand the technology a bit?
Yeah, I'm going to be very cautious about that, of course.
Sure.
Google has it. Amazon has it. There's a number of competitors out there. And, like I said, you can bring together a group of engineers and write code on top of the speech to text component, write AI and develop something out of it. We've obviously been doing it for decades. We've got very experienced engineers. We've got the power of Microsoft now. And yes, there are competitors out there. I could rattle off 3 or 4 right off the bat, and they each have their own specific markets or benefits and detractions. I can tell you some of them are much smaller shops. They don't have millions of lines of code like we do. They may not have the CDI depth of experience like we do. That's clinical documentation improvement. Also the coding factor of that and the virtual assistant. So we, years ago, before I was even using full-time voice recognition, maybe 8-10 years ago, I was asked to do an interview and people were asking me, well, what's Nuance got in the speech recognition market? And I jokingly said, they're the 800-pound gorilla, and fast forward 8 or 10 years, and here I am, a Nuance employee. So I was very lucky. I used it, and I was a CMIO for a really big health system before I joined Nuance. So I had a lot of experience in many service lines. But I can tell you, one of the companies we actually acquired a couple of years ago was a voice recognition company. And we liked their business model. We liked their engineering talent, and we absorbed them. But when we dug under the covers of the AI, it wasn't even close to what we had. So my point is, there probably are a lot of speech recognition and AI companies, but if you scratch the surface, most of them very similar to what I described with the quality documentation specialist or virtual scribe. We talked about scribes before, and we could go into more detail about that, but they're using something on the back end to help their AI along. We do too, but you know what? Very soon we're going to be 100% automatic. The scribe will be a robot, and it's going to be very, very accurate. We do it for quality reasons. I think that's a smart way to go. But I would say that our technology is leaps and bounds ahead of most of the competitors because we have such a huge healthcare footprint to begin with.
Yeah, that makes sense. And what about analyzing the clinical visit? Does a system look at the paralanguage, tone, pitch, pace, all that kind of stuff to analyze what's behind the content, the words being said? Does it flag things as hey, notice this, notice that the patient said this?
So specifically,
these are
to your point, that's a fantastic question. I'll try not to be too lengthy with this one. You mentioned virtual assistants. Okay, what is a virtual assistant? That's me talking to the computer, and it's either talking back to me and providing me feedback, or taking a task for me automatically, or using AI to find more information. Okay, I might say something simple like, show me the next appointment, or show me the last blood test. Can you pull up the chest x-ray? So it's doing a task for me, but it can also do things for me in terms of ordering, send a prescription to the pharmacy, create an appointment for a physical therapy visit type of thing. Now let's take that to your point. Let's make it even smarter. What if it's, to your point, listening to the pitch, the cadence, other biometric things that we can find within the voice? Say, the virtual assistant is giving you a little alert that says, this patient might be depressed, or something's different from the last time, or even diagnose, perhaps, depending on what the biometric parameters are. Okay, the patient's got a hoarse voice, maybe they've got laryngitis. But there are a number of things that I think that will continue to come out of engineering development and the quality of the tools and the technology that will be able to do things like that as well. So the virtual assistant capabilities will get stronger and stronger. One other important thing is, I mentioned the coders and the documentation specialists, and the physicians to say, hey, not only that, and we're currently doing this with another software program, eventually that will get melded into or integrated into DAX, whereby, let's say, they're short of breath and they're having difficulty breathing, and their respiratory rate is discovered as being too high, or their oxygen is too low, and we know that they need oxygen supplementation, or they need to be emergently intubated, where the virtual assistant could tell you, hey, this patient might be in respiratory failure. So you could take it even further. It's pretty incredible what the opportunity is there. And we see that as a big green field beyond just creating the notes. Creating the notes by itself is tremendous. Getting patients and providers back face to face, the satisfaction that we're hearing in the surveys from both sides. And now adding to your point is, I can also read the voices and get deeper inferences about what's happening with the patient.
Yeah. And are any companies using it for quality control? Like, did the clinician ask about smoking, or did the clinician offer this service based upon what they said? So like, does AI review looking for particular things for quality assurance with visits?
Yeah, you definitely could program those things in. And there's a fine line there between what are the processes and capabilities that the EHR is really good at, whether it's alerting or assisting or alerting too much and creating alert fatigue, versus what's really important and high priority. To your point is, okay, maybe I do need to ask about smoking, or, are you taking your medications appropriately, type of thing, versus some of the other things that you mentioned. But we're very careful about planning the roadmap and looking at the capabilities and, what's the low hanging fruit? Where's the big challenge? Where's the big win? One of the things that we've recently been talking about is, beyond diarizing a note, how can I go even further, like predict the future? Or what's tomorrow going to look like? Or, what will be what'll be a final statement that needs to be within the note, type of thing.
Right. Yes, definitely. Yeah. Well, thank you very much. And the best way for people to find out more, and is there like a trial period for organizations to test out using this technology, or what's the process for people to go through if they're interested in using this technology?
So I mentioned just do a Google search or a Bing search. Have to put a plug in there for Microsoft.
Yeah, that's right.
Just type in DAX, DAX, for healthcare, anything. You can use a bunch of search strings, but you'll find tons of stuff out there. So that's one thing. Nuance.com still has its own website. So you could certainly go there. We have a number of testimonials, links to white papers, videos, and so forth. YouTube has a pretty extensive Nuance library as well. Plus, many of our customers are starting to put this out. As I teed up one from DAC, from Scripps, just in case. It's fully public facing. They said we could show it, but you could look at DAX and Scripps there in San Diego and see what they're doing with DAX. And it's a pretty spectacular video they've made. And depending on your users and their managers and sales agreements, whether they're using Dragon or not, they could certainly reach out to their area representatives. My email is robert.budman@nuance.com. Pretty easy. I'm happy to help point people in the right direction or give them more information about it. In terms of pilots, believe it or not, the DAX pilot is pretty easy to set up. The pilot itself would just do the recording, like I mentioned, on the phone, and that is a step in the right direction. When we want to do is really deeper integration eventually, notes that flow into the EHR relatively well integrated and almost automatically. Of course, they do have to sign them off. But the pilot is pretty simple. We're going to use your voice biometrics. You're going to get an app, get approved for it, start recording, and our technology in the cloud, it's in the Microsoft Azure cloud. You mentioned some of the differentiations. The Microsoft Azure cloud has just got phenomenal security, speed, stability, virtually no downtime at all. So it's always there whenever you need it to run. And, that makes things work really well for us. It's been a great partnership because we were on them before we got acquired. And that sort of symbiosis grew and grew over time.
Yeah. And what about for behavioral health? Are people using it for behavioral health? Is the AI built out for that?
So it's not fully built out yet. It's on our roadmap. It'll probably be released probably within the next year, 18 months. I don't know the exact time frame, but we know that target audience would be a huge benefactor of DAX, ambient clinical intelligence technology. As I mentioned, back face to face, capturing the full narrative, and in the future, using that AI to read with NLP, whatever's within the notes for important findings and summarizations, and using artificial intelligence to help with diagnosis, as well as alleviate that burden and get that satisfaction back in that doctor-patient relationship or behavioral health provider-patient dyad that's so important. It makes it much more personal.
Right, certainly. Yeah. Well, thank you very much, Dr. Budman. It's very helpful. Love the technology. Glad that Nuance is working on this along with
It's been a pleasure
Microsoft.
speaking with you. Thanks for having me.
Yep.